Good morning, afternoon, and evening. Thank you all for joining today's webinar, Supporting Optimal Maternal, Infant, and Young Child Nutrition in Jordan. I'm Devin Andrews, the Communication Specialist for the Jordan Nutrition Innovation Lab, and I will be your MC today. As more attendees are joining the webinar, I will begin by going over some logistical items. Next slide. I would like to direct all attendees to a few functions on this Zoom call. At the bottom of your screen, you should see a chat icon and a Q&A icon. Please use the chat feature to engage in relevant conversation with the other attendees. Next, please. If you have a question for one of the panelists, please use the Q&A feature. Feel free to type your question in English or Arabic as you prefer. Panelists will respond to questions in the Q&A as they are able. We have allotted the final 15 minutes of this webinar for Q&A, at which point the panelists will respond to any remaining questions from the audience. If you are experiencing technical difficulties, send a message in the chat to panelists so that our technical support staff can work with you to help resolve any issues. This webinar is being recorded and will be made available on our website following the event. We will repeat these technical housekeeping items in the chat throughout the webinar, as people may be joining in at later times. Next slide. I would like to begin by introducing Dr. Shibani Ghosh, who will be the moderator for today's session. Dr. Ghosh is a research associate professor at the Friedman School of Nutrition Science and Policy. She is the principal investigator of the Jordan Nutrition Innovation Lab and is also the associate director for the Feed the Future Food Systems for Nutrition Innovation Lab. Her research interests include examining malnutrition in all its forms, formulating and implementing evidence-based interventions targeting nutritionally disadvantaged populations, and translating innovative basic and clinical sciences research into applied community-based research. Shibani, over to you.
Thank you, Devin, and welcome everybody to the first webinar hosted by the Jordan Nutrition Innovation Lab. Today's webinar is part of a series that will focus on issues in research, policy, and programming around maternal, infant, and young child health and nutrition that are of critical importance in Jordan. We will be sharing with you in subsequent follow-ups further details on upcoming webinars via our mailing lists as well as through social media. So please do not forget to subscribe to our different media platforms. Today's webinar includes an illustrious list of experts who work in maternal and infant and young child health nutrition policy, programming, and research to support optimal health and well-being in Jordan. We will begin this webinar with an introduction by the Director of Population and Family Health at USAID Jordan, followed by two short presentations by the Chief of Party of the CHN program and myself as a representative of the Jordan Nutrition Innovation Lab. We will follow this with a very lively panel discussion that will include experts across the different spaces within MIYCHN. And finally, we will be taking a moderated Q&A. As noted by Devin, please do use the Q&A box to ask your questions. And while the webinar is entirely in English, do absolutely feel free to ask your questions in Arabic. We will ensure that these get addressed. In terms of the webinar itself, since it's a very packed schedule, I'd like to introduce all the speakers, after which I will hand over to Bethany Haberer. So let me begin with, first of all, introducing Bethany, who is our first speaker. Bethany is the Director of Population and Family Health at USAID Jordan and has significant experience, foreign service experience, has been with USAID for 13 years. She served as the Presidential Management Fellow to the Health Sciences Advisor of the Office of HIV/AIDS in Washington, D.C., and has worked as Programs and Operations Officer in USAID Tanzania, as well as the Director of Health in the Democratic Republic Congo USAID mission, as well as USAID Haiti. Prior to USAID, Ms. Haberer worked at the U.S. National Institutes of Health at Emory University, and she's also been a Peace Corps volunteer in the Togo. She holds a master's in public health and a BS in biochemistry and biological sciences. Our next speaker is going to be Doris Youngs, who is the Chief of Party of Community Health and Nutrition Activity at FHI 360. Doris is an international public health practitioner who brings over 25 years of experience managing complex, bilateral, and centrally funded global projects focus on maternal, newborn and child health and nutrition in over 60 countries across the Middle East, Africa, Asia, and Eastern Europe. She's passionate about advocating and designing health systems to ensure equitable supply and use of customized high-quality nutrition services while linking them to robust social and behavior change strategies. Her focus is to leverage the use of evidence-based research and innovative practices to inform programmatic interventions. Our next speaker, which is going to be part of the panel discussion, is engineer Rawhieh Barham. She is the head of the nutrition department, PHC administration at the Ministry of Health in Jordan. Engineer Rawhieh is responsible, has a large mandate across her department and in supporting the health and well-being of Jordanians. In her experience, she has developed and promoted dietary and NCD management guidelines, led national studies on the assessment of micronutrient deficiencies and fortification programs, provided assistance with nutrition, dietary, policy coordination, and nutrition education for Jordanian and Syrian refugees in collaboration with UNICEF and WFP. Engineer Rawhieh has been awarded a certificate of appreciation for her significant work with the nutrition unit at the WHO in the Eastern Mediterranean region and her leadership with the nutrition program. Following this, we have Dr. Rima Safadi, who is the professor of nursing, maternity and child health and nutrition at the University of Jordan School of Nursing. She teaches and mentors graduates and undergraduate students in nursing, medical, and women's studies. She has served as a technical and steering committee member for the establishment of the Baby-Friendly Hospital Initiative in collaboration with HCAC, and also is a Lamaze certified childbirth educator. She advocates significantly for mother and infant rights to natural birth processes. Her research interests include reproductive, maternal, and infant health, gender issues with a focus on breastfeeding, pregnant women's weight status during pregnancy, refugee health, and gender-based violence. Dr. Safadi has been a Fulbright Fellow from 2015 to 2016 and has conducted research on acculturation and marital relationships of Arab American women in the United States. She has held several positions across the university, including being the chair of the Maternity and Child Health Department at the University of Jordan, and has also been the Dean of School of Nursing at 2 private universities in Jordan. Next, we have Dr. Asma Basha. She is the Director of Obstetrics and Gynecology at the Jordan University Hospital and is a professor of the University of Jordan School of Medicine. She graduated from the University of Jordan with a bachelor's degree in medicine and a master's in obstetrics and gynecology with a subspecialty in fetal-maternal medicine from Sydney, Australia. Her research interest is around women's health throughout the different stages of the life cycle with a priority in pregnancy and maternal well-being. She is a member of the Medical Council for the Medical OBGYN exam, a member of the Sexual and Reproductive Health Jordan, and a member of the Council of Women's Studies Centers at the University of Jordan. Last but absolutely not the least, Dr. Iman Badran. Dr. Badran is the director of the neonatal unit at the Jordan University Hospital and is faculty at the University of Jordan School of Medicine. She is an established clinical researcher who has published over 74 research articles in peer-reviewed journals, textbook chapters, as well as contributed to abstracts and presentations in a number of professional association meetings. Currently, she works on several projects which target breastfeeding in Jordan, including the establishment of the National Baby-Friendly Hospital Initiative in collaboration with HCAC, which is the Healthcare Accreditation Council. Dr. Badran has led a number of prestigious leadership positions and is a member of the Jordan Medical Council, a member of the Board of Trustees at the Al-Balqa Applied University, and a committee director of the Neonatal Health Improvement Program at the Ministry of Health. As you can see, we have an illustrious list of speakers and panelists. I'd also like to note that several of our panelists are members of both advisory committees at the CHN program, as well as the Jordan Nutrition Innovation Lab itself. So on that note, I'm going to hand it over to Bethany to open this webinar with her remarks. Bethany.
Thank you, Shibani. Dear esteemed panelists, colleagues, ladies and gentlemen, good afternoon or morning, everyone, and marhaba. I have to tell you, I'm so pleased to see such a strong turnout today and participants from around the world. I noted from the chat box that we have colleagues from Tajikistan, Zambia, Australia, the US, and of course, a strong showing from Jordan. So welcome everyone. I am so pleased to join you today for this webinar on supporting optimal infant, young child, and maternal nutrition and health in Jordan, arranged by USAID's Jordan Nutrition Innovation Lab activity, or as we call it, JNIL. USAID is proud of its nearly 70-year partnership with Jordan, working to improve outcomes in the health sector. This collaboration has supported healthy individuals, families, and communities in Jordan, who can then better contribute to the kingdom's economic development and prosperity, a goal shared by both of our countries. The resilience of Jordan's health sector and the strength of our partnership have been tested and proven in the response to COVID-19. USAID is proud to have supported all pillars of Jordan's national COVID-19 response plan, from a significant increase in testing capacity to training to provide specialized care for the sickest COVID patients to technical assistance in COVID-19 vaccine introduction. Another key area of collaboration is based on the sector we are here to discuss today, nutrition. As most of you know, Jordan faces a dual burden of overnutrition and undernutrition. The Jordan Population and Family Health Survey of 2017 and 2018 found that 55% of Jordanian women are overweight and nearly 17% of newborns had a low birth weight, which is one of the highest rates in the Middle East. These kinds of outcomes negatively affect Jordan's long-term stability and economic growth, as malnourished children are more susceptible to disease and more likely to have poorer educational and health outcomes and reduced economic activity even into adulthood. Shortly before the pandemic, USAID Jordan launched a comprehensive suite of activities supporting a range of nutrition interventions, including the Community Health and Nutrition Activity, or CHN, and the Jordan Nutrition Innovation Lab, or JNIL. Today's event comes as part of JNIL's efforts to link academic researchers with policy and decision makers through the promotion, sharing, and dissemination of evidence generated on nutrition and infant and young children feeding practices in Jordan. This and subsequent webinars will also be a platform for capacity building of young upcoming Jordanian students and researchers within the space of nutrition and infant and young child feeding. After this workshop, the JNIL team will continue working with all key stakeholders, so please stay involved. You are the experts, and your continuous engagement is so highly needed and very much appreciated. I want to give a heartfelt thanks to all our experts on the panel today for sharing their time, their knowledge and experience in this important area. I also want to invite all participants to actively engage, to ask questions and share your ideas and experiences. And finally, a big thank you to our organizers for their tireless efforts in making this webinar a success. With that, I wish you every success in the discussions today. Thank you.
Thank you, Bethany. I think we're going to go over to Doris. And Moad, if you don't mind sharing the slides, thank you. Lovely, thank you. And thanks for the participants for letting us know that y'all can see our screen. I think while we're waiting for to Doris to come back on, I just want to sort of maybe take a minute to introduce to you what we're going to be talking about in our panel discussion. And one of the issues as sort of Bethany outlined in her remarks was that we need to really, for us to make changes within the maternal, infant, and young child nutrition space and support women with better services, we need to work across the policy, programming, and research space. And so what we wanted to understand from our illustrious panelists is what are the achievements, but what are the challenges and burdens around the space, and what's the way forward for MIYCN? And so what we're hoping to do is generate a conversation around national policies and priorities, the evidence and capacity building needs, that we hope will continue beyond this webinar. And as Bethany has pointed out to you, that we are hoping that this engagement continues across all the different stakeholders that are participating today, and particularly our stakeholders that are in Jordan, whether you're from academia or from the policy space or from programming. And so that's essentially what we are hoping to achieve, but we'd also like to use this panel discussion to open the conversation around the research and capacity building needs around MIYCN in Jordan, whether you're looking at it from the angle of someone who is a practitioner, someone who's a clinician, or someone who's a researcher. So that's really the objective of the panel discussion.
Okay, great.
Right.
So sorry, everyone, not sure what happened, so.
Well, okay, so we're back on track.
Right in, so. Sorry, and thank you everybody for your patience. Basically, I will jump right into my presentation. I have the pleasure to introduce the Community Health and Nutrition Project, which is funded by USAID. Next. The project duration is 6 years. We started in May 2020 and it will go on till 2026. The prime on the project is Family Health International, FHI 360, and our strategic partner is the Jordan Ministry of Health, the Primary Health Directorates, mainly Health Communication and Awareness Directorate, as well as the Women and Child Health Directorate. We're very proud to have on our consortium 3 very strong local partners that lead the implementation of a number of our initiatives, and they're the Royal Health Awareness Society, the Institute for Family Health, and the Healthcare Accreditation Council. Next. The project aims at showing improvements, measurable improvements in 6 key practices. We focus on enhancing dietary diversity during pregnancy, early initiation of breastfeeding, exclusive breastfeeding through 6 months, and then continuing through 2 years. And then the timely introduction of appropriate complementary foods, use of modern contraceptive methods postpartum, and healthy family diets. And the time that we're looking at, the time frame that we're looking at, starting at pregnancy all the way to 24 months postpartum. The project is also focused on COVID-19. During COVID-19, we were asked by the Ministry of Health to support the government of Jordan's efforts in combating COVID-19, basically by focusing on promoting preventative measures and vaccine uptakes. And we did that through a number of national programs and outreach activities. Next. The 3 pillars of this project, the way I'd like to think about it, is the household and community component that we have to focus on and ensure that we're increasing the knowledge, attitude, and skills at that level, and then linking it with the healthcare provider support and a system under the healthcare service delivery, and then making sure that those 2 are linking to produce the measurable improvements. Our project is really based, and the design of our program really depends on research findings. We have done a number of literature reviews, formative research, as well as market analysis, and we're still doing ongoing monitoring and evaluation. Next. I love this slide because it shows the community. It shows the mother sitting right in the middle with all the networks and the support systems that could actually hinder or encourage her to adapt the practices that I've listed earlier. And just to give you an example, we could have religious leaders promoting messages to encourage breastfeeding up to 24 months. Social media can be sort of a double-edged sword. The mother could be getting misconceptions from the social media, but she could also be getting support from groups and communities that promote breastfeeding. Same thing for work. It could go, we could have policies at work that support the mother or not. Next. This is the part of the that we're talking about with the social, with the healthcare provider support. We look at creating model healthcare services to support MIYCN And what we are looking at is creating optimal healthcare service modalities, and we're looking at a social franchise model. I will highlight 3 initiatives that we have under the social franchise model. One is the creation of a lactation counselor certification program, then a standardized service package, and finally, we're bringing in global resources into Jordan by bringing in national and regional infant and young child feeding courses using e-learning. We're translating it into Arabic as well as adapting it into the region, and we're complementing it with classroom training. And I'll discuss a little bit more about it during our panel discussion. Next. And this is my favorite slide. It basically shows the linkages. It shows the mother and the child and the household as the center of our support, and making sure that these practices have to happen at that level. But it's also basically surrounded by all these networks that I talked about. But I've added to it also the service delivery, the component, to make sure that the systems are all working together. And just to give as an example, let's say the mother needs support to get information about breastfeeding. She might be referred during her antenatal visit to a support group or to a community-based organization awareness policy dialogue. And then when she goes there after delivery, if she is visited by a community mobilizer and volunteer, she can be, if she needs more intensive help with lactation or with breastfeeding, she can be referred to a private hospital or a public hospital or a public clinic where there will be healthcare providers and lactation counselors to support her. Thank you, everyone. Looking forward to the conversation, and I apologize again for the delay.
No, thank you.
On to Shibani.
Yes, thank you, Doris, so much. We appreciate you're able to jump in and just restart. So I appreciate it. So thank you. I'm going to just do a very quick introduction to the Jordan Nutrition Innovation Lab itself. And I think I'd really like to spend the hour that we have in this webinar, the next hour, on the discussion and a Q&A from our colleagues in the audience. So I'll ask Moa to go to the next slide, please. Thank you. I don't want to go into this. I think most of us on this webinar are familiar with the issues related to nutrition within the maternal and infant and young child space. But critically in Jordan, I want to make 2 points. And this was something that was highlighted in a policy brief from one of the UN agencies around the Food System Summit, around the double burden of micronutrient deficiencies and overweight and obesity within the context of both women and children in Jordan. And particularly as it's highlighted, and that's something that also the CHN program has highlighted, that are poor early life practices, whether it's around breastfeeding or around complementary feeding. Next slide, please. This is just to show you some data, particularly on complementary feeding practices. And what we are seeing is that while there is a increasing level of minimum dietary diversity, which are the orange bars on the slide on the right, what you find is that a lot of infants and young children in Jordan are not meeting minimum meal frequency, but they're not meeting a minimum acceptable diet, which is likely linked to the fact that they are probably consuming foods that are not nutrient rich and nutrient dense. And therefore, we have to think about micronutrient deficiency starting off at a very early age in these kids. Next slide, please. So the objectives of our lab is to really understand and support nutrition research policy and programs in Jordan within the context of maternal, infant, and young child nutrition. And we have really 2 objectives. One is to implement a rigorous research agenda, and 2 is to support capacity building. But within the context of both these objectives are 2 things. One is extremely important for us to be very policy relevant, and 2 is to link our research to policy. So within the context of both research and capacity building, it is extremely and critically important for our mission for it to be successful that we will link to policy. Next slide, please. So I'm just going to briefly go into each of the objectives. The first objective is really conducting policy relevant research, and we have different components to the policy relevant research. And I will give you one example of how we are working around programs such as CHN and understanding how programs such as CHN function in supporting optimal health and nutrition in this population. So if you go to the next slide, please. And then the second objective in capacity building is really very much focused on enhancing both individual and institutional capacity so that we can generate and disseminate and inform policy relevant actions within the context of Jordan, And so some of the activities I'm going to outline include fellowships, webinars, such as the one we are hosting today, conducting research methods workshops, particularly for young academics, conducting a symposium that brings not just researchers, but also policymakers and programming specialists together in one space. Next slide, please. So this is just an example of the research that we are conducting. This is an evaluation project that we are undertaking with the CHN program. And there are three components to it. We have an impact evaluation, we have a process evaluation, and we have a sustainability assessment. And given the paucity of time, I'm not going to go into major details here, but I just want to outline what the activity and the objective are. But the key point here is the evaluation has a cluster randomized study design that allows us to work with the CHN program in the way they roll out in assessing different aspects of outcomes, process, and sustainability. Next slide, please. And this is just to outline the different components and the kind of research that we are conducting. We have both quantitative and qualitative components to our research, which include surveys that are done with the beneficiaries, which are pregnant and lactating women and their young children, surveys with providers, healthcare providers who specifically target those services for pregnant and lactating women, as well as for young children, as well as qualitative assessments, both with the providers as well as with the beneficiaries. Next slide, please. And in terms of the objective 2, which is about capacity building and linking, generating capacity and linking it to research and policy, as I've outlined, we have several different activities. The first is a fellowship program, and it's a small fellowship program, but we hope to award 3 fellowships per year. If you haven't seen the call, please look out on our website as well as on Twitter, where we have a call for 3 fellowships this year to support young Jordanian scientists and professionals to generate evidence within the space of MIYCHN. We are hosting research and policy webinars, which will happen on a quarterly basis. We are hoping to plan an annual research methods workshop, and we are hoping to host ours this year in August of 2022. And finally, I want to highlight the fact that we will be hosting an annual research and policy symposium where we want to bring together Ministry of Health, other line ministries, policy experts, policy planners, researchers, students, academics, faculty, as well as programming professionals, with the focus on generating and sharing evidence emerging within this space. Next slide, please. This is just to give you an idea of our organizational structure, and we are very fortunate to have a great team in Jordan, and we have a great technical advisory committee in Jordan composed of different academics, programming specialists, and policymakers who are guiding our process and our implementation in the country, particularly around the capacity building activities. Next slide, please. This is just to highlight what our partners and our collaborators in country. You know, we are very excited. We have been delayed because of the COVID pandemic. However, we have been fortunate to be able to start working last June, July. And so we're really, really excited for 2022 to be the year where we will be able to implement quite a few of our capacity building activities. So thank you so much. And I think I need to jump into the panel discussion, and I'll ask Muad to stop sharing the slides at this point. Thank you. And one note to all our participants, please do put your question and answers in the Q&A box. I'm sorry, the questions in the Q&A box, and we will get to it when we do the moderated Q&A. So I appreciate your patience on it. But I also will request all the panelists to just put their video on for a brief minute. Thank you. And I think we have engineer Rawhieh, who I hoping you're there. Wonderful. Thank you so much. So I just want to, and we have Sama Al-Quran, who's from USAID. Thank you, Sama, for joining us. The panel is going to work with me, just handing it over to the first speaker, who is going to be Engineer Rawhieh. And following that is going to be Doris Youngs, after which we will have Dr. Iman, Dr. Asma, and Dr. Rima. And then we will have a moderated Q&A, and Sama will be closing out for us the webinar at the end of the session. So without further ado, since I've already given a little bit of a description on the panel, I'm going to hand it over to Engineer Rawhieh. Just the one point I want to make on this is that we will give each panelist 5 minutes, and I apologize, Engineer Rawhieh, I realized I need to give you your questions. That each panelist will receive 2 questions, and we will have each panelist respond to those questions, and then we will go into the next round if we have time, or into a moderated Q&A. So Engineer Rawhieh, the first question for you from me, and from the context of the objective of this webinar is, based on your experience, could you outline and highlight some key achievements, policies, and initiatives of the government of Jordan within the context of maternal health and infant and young child health and nutrition? Over to you.
Yes, good afternoon. Jordan is committed to work towards the World Health Assembly Global Nutrition Targets by 2025 and nutrition-related targets of the Sustainable Development Goals by 2030 to eliminate all forms of malnutrition by underlying the 6 key areas for action. Jordan has achieved progress in reducing undernutrition of stunting and wasting among young children in recent decades. The country is currently meeting the global target of maintaining the level of wasting to below 5% by 2025. As well, also there has been notable progress in reduction of stunting to almost 7%. This indicates that the country is on track to reach the global targets for the number of the children affected by stunting. As well, the prevalence of anemia has been significantly reduced among the non-pregnant women by 25%, according to the latest available data from the National Micronutrient Deficiency Survey 2020, and 11% in the children at 6 to 59 months of age. Overall, there was impressive progress in reducing severe anemia. In the area of the childhood overweight, actually there was a slight increasing in the prevalence of overweight, and according to the WHO classification, it represents as a medium public health problem that merits attention. This is the achievement which copied the as well the regional nutrition strategy of the Eastern Mediterranean 2030.
I realized I was on mute, but the next question I have for you is, what do you see, given these achievements, what do you see are the challenges within health services in Jordan to support women around breastfeeding and infant and young child feeding?
Yeah, Jordan has a legislation implementing some provisions of the International Code of Breast Milk Substitute, but the measures are not comprehensive, and monitoring and enforcement is weak. So there is a need for implementation policies like monitoring and evaluation activities. As well, poor integration of nutrition into the health system has been identified as one of the weaknesses for improving nutrition in the current context in Jordan. A lack of nutrition counseling in the MCH, nutrition healthcare providers, and professional capacity have also been identified as a weakness. So there is a general lack of knowledge practices in nutrition counseling or nutrition awareness. Sessions are not delivered appropriately, and there is a limited staff within the context of MCH who are able to support the nutrition session prenatal and post-delivery.
Thank you, Engineer Rawhieh. I appreciate your comments on this. And on that note, I want to pass it over to Doris. Doris, I have two questions, and just to give you the floor, I'll just ask those two questions at the same time. First of all, what is the role of programs such as the CHN in supporting MIYCN in Jordan? And how can other development programs and interventions, or even agencies, whether UN, bilateral, or other, support the government of Jordan in the efforts around implementing national policies?
Thank you. Our vision for the Community Health and Nutrition Project is basically to accelerate child, maternal, and infant health and family outcomes by basically focusing on a systematic approach that's based on a socio-ecological model for change that engages and empowers communities to become champions of their own health. And at the same time, addressing issues on the supply side. And by the supply side, I mean the service delivery component, so that the demand side, so when the community is demanding or asking for certain services, the service delivery component is ready to respond. And we create very strong linkages between the two, because if the two are working together, then there is communication, there's flow of information, and there's adjustment of the different services, basically adjusting to the needs on the ground. We're also creating sort of a social movement. We're looking at creating a social movement that leverage a social and a mass media to create and engages with other groups on the ground that are passionate around the issue of MIYCN, and basically to create excitement, bring up the visibility of the importance of the issue, and actually hold ourselves a little bit accountable and keep things moving forward. We all know that adapting optimal infant and young child feeding practices is really important to reduce malnutrition and benefit the nutritional status of mothers and children. We also know that studies have shown that breastfeeding, exclusive breastfeeding for 6 months, actually protects the mother and the child from undernutrition or obesity. So it helps with both. And if you add to that, basically early initiation of breastfeeding and lactation support, we found that this actually helps the breastfeeding to be successful. And now I'm going to move a little bit about our relationship with the Ministry of Health and explain how these best practices and what I've just mentioned sort of connect together. For the Ministry of Health is our strategic partner. We really support all of their efforts. We reinforce their initiatives and activities that are focusing on MIYCN, and they're really we sort of work hand in hand. We look at creating model healthcare services, and these model healthcare services we try to bring in global evidence. And our latest approaches that we're working together on is a model franchise that actually provides, that can be applied either in the public sector or in the private sector. And under that franchise model that's bringing in best practices, we're focusing on the healthcare provider so that we make sure that we're strengthening the capacity of the healthcare provider to be able to basically provide that optimal service that we're all looking at. And for the healthcare provider, we're bringing in certain trainings that we're bringing different modalities, working very closely with the Ministry of Health to make sure that we are using different tools. And one of the things that we're bringing in is the e-learning course. This is an e-learning program that was developed by FHI 360 under a global project, Alive and Thrive, and in collaboration with UNICEF. And it was approved by WHO. And the idea is that it brings in the latest information related to IYCF, infant and young child feeding, but it also serves as a resource because it's going to be translated into Arabic. And it serves as a resource not just to the healthcare provider, but also to make sure that the healthcare provider is not only exposed to it once, they can go back and access the information as many times as they need. So it serves as a reminder. We really want to make sure that whatever we propose can be sustainable and leveraged by the institution. In addition to strengthening we want to look at, I've mentioned earlier about the importance of, I've mentioned the lactation counseling, and that it's really important for the success of breastfeeding. We're trying to professionalize the lactation counseling service by creating a new cadre of lactation counselors. These that provide, that address this gap in counseling. It exists right now, but it is part of a role. It's not focused, and it's not completely focused on the counseling for breastfeeding. It's actually part of somebody's role. And we want to make sure that there is continuous professional development in all of these trainings, so that the healthcare provider is spending a lot of time gaining the skill. It should be recognized somehow. And this is where we're linking it with professional development credits. You've mentioned the UN agencies. The UN agencies are very important for us. We link with them. They are a group that have been developing platforms, developing tools and resources that are focused on maternal, infant, and young child feeding. And they are a group that also has a lot of initiatives that were very successful in Jordan. So our approach is really to try to link with mainly UNICEF and others with our training course that I just mentioned, but also in complementing their baby-friendly initiative, make sure that we are complementing each other, and also to make sure that we're coming up with standardized training packages. Now I want to go into the academic institutions, which are really, really important. I'm looking at Dr. Iman, and she's an advisor to our project, as well as others on the panel. And basically the research that they have carried and the initiatives that they're implementing have been a great help to us, because we're able to use evidence-based solutions and to inform the design of our program and make sure that they continue to be relevant to what's happening on the ground. So that's one thing. Another thing is basically reaching out to academic institutions to ensure that some nutritional content is incorporated into their curricula, which we identified as a gap in some of our research. And I want to thank JNIL actually for holding this symposium and actually putting the focus on the importance of research and how important it is to sort of use evidence-based. But also, as we are rolling out the program, we're coming across gaps in the knowledge around certain practices. And it will be great that we are linking and working together, because we can share those gaps with JNIL and with our academic colleagues so they can carry research. And JNIL, I know, is providing supports and fellowship and funding to really support some of those initiatives. And finally, I want to talk about policies, because you mentioned policies. There are a lot of great policies in Jordan. We are lucky. We have a lot of policies that already exist. Our challenge continues to be adherence to those policies. So I would like us to sort of continue to talk about advocacy, to adhere to those policies, make sure they're incorporated into the design of a lot of our programs. And finally, if there are policies that actually are hindering, they don't exist. And one that comes to mind is the supporting breastfeeding in the workplace. We have seen a number of mothers saying that they will stop breastfeeding once they go back to work, because there is no policy that forces sort of the workplace to have a lactation space, a privacy, or even to store milk safely. So we should continue to sort of challenge ourselves and look at the policies that exist and supplement and advocate as needed. Thank you.
Thank you, Doris. Thank you very much. I have to say that last point actually addresses one of the questions that has come up. I mean, I think it starts the discussion on what do we do for women in the workplace, and what I'm hoping that all of us on this panel, but also stakeholders in Jordan, we think about how do we move forward with this in creating a supportive and enabling environment for pregnant and lactating women in Jordan, because the will is there. The question is, how do we implement that will, and how do we adhere to what has been outlined? On that note, I feel like I should really bring in Dr. Iman, who is going to be talking about some of the issues and the challenges in Jordan around implementing actions to support women. So Dr. Iman is going to use some slides, and I will ask Moa to, thank you for putting it into slide view. And Dr. Iman, I think your presentation is really going to highlight the challenges and gaps in Jordan, and what are the key actions that one can take to support capacity of health professionals in Jordan around MIYCN. So let me hand it over to you.
Yeah, so good morning for everybody, good evening, and good afternoon. I'm so excited to participate for this program, this webinar. I think the answer will complement what Doris says. But I want to answer you through the passing our experience in establishment of baby-friendly hospital in Jordan. So next slide. So before starting to discuss, the slide just before, we have found, before I start talking about experience, we found this, that Jordan's government demonstrate high level of political commitment. And this paper, which was a review of the nutrition status in Jordan trends and a way to forward this, is an demonstrate excellent work which was done by stakeholders in Jordan. Next. So next slide. So when we start the baby-friendly hospital, I met with Dr. Rima, and we thought that maybe there is decentralized government system. We thought, is the stakeholders have the lack of experience, especially in critical sectors like Ministry of Health. That's what we were concerned. So we thought we need to assess the committee and the commitment and the capacity of stakeholders to address the maternal, infant, young childhood nutrition, and mainly the breastfeeding. So we want to know if they are engaged, are willing to implement what we thought about it, and do they have the capacity to monitor the process. Next slide. So that's what's called advocacy, as Doris said, and we want to implement. We want to know how they are, what the willing, the commitment, and the capacity. So I went with Dr. Rima, and we asked a senator to come with us. And we went to meet with Ministry of Health. And we found that they have good effort. And after that meeting, they established a small breastfeeding committee so they can work, we can work together. Next slide. During my preparation for this question, Sri Lanka, for example, and Bangladesh and South Africa, it seems that they found similar challenges. And even as Doris said, there is policies, but we don't know what's the policy. So they assess in Sri Lanka and in Africa, the policy, the document, and the willingness and the commitment of stakeholder through certain qualitative research or quantitative research, and they analyze how they are committed and what are the capacity building to support these nutritional program. So next, this is from the South Africa, you can go to it later, next. So the other challenge was for us, well, is there any policy, as any favorable surrounding environment around us? Next. So is there an available correct policy? Are they updated? So we look to the appropriate policies. Next. And we want to know, is everybody aware of the document? Are the stakeholders supporting these documents? And I would like to show you 3 examples how different countries look to this point. Next. So this is a policy content and stakeholder network analysis for infant and young child feeding in Bangladesh. They did it in India and they did it in Nepal. So maybe this is a window of opportunity to do similar to this project in the symposium meeting in August. Next. So another advocacy is that's what I felt we needed, that our institution need to be supported by stakeholders, okay? Need to be supported by Ministry of Health, need to be supported by HCSC, by the UNICEF. How they, when we felt that this is, they make these stakeholders make our institution feel that it's important to review the policies, to endorse the policies, to update the policies. We know when we talk together, what are the gaps, and how to convert these policies to system that has implementation tool, that has action plan, and how assess them and monitor the system. So we started this effort, but once the HCAC were involved with us, we were pushed regularly to do this, this system. Next. Of course, I know there is a lot of researchers, but the research we come across in Jordan, not all of them are representative. So maybe through this collaboration, we can find opportunity for the research funding and to this research, representative research, through collaboration with stakeholders. Shall I go to the next question?
Oh, yes, please. Yes, do go ahead. Yes.
Okay. Shibani asked me that the multi-stakeholder technical steering committee, technical advising committee in the CHN and Jordan Nutrition Innovation Lab, how they can contribute to policy, foster policy engagement, to the research update, and to the capacity building efforts. So these are my answers through literature reading. And I will answer you also through our experience. So it was critical for us, and when we worked to the multi-stakeholder, the Ministry of Health, the SCAC, the WHO, and the UNICEF, who are the critical key stakeholders, okay? And we want from them to establish a coordination of mandated responsibilities, okay? And to encourage the multiple stakeholder partnership. And there is a point here I want to say, and before going to this partnership, it's important that the policymakers in the institutions should sign the mandate, okay? Should sign the mandate, they are committed. Next. So how to encourage multi-stakeholder, why to encourage the partnership? Because as an institution, because as a researcher, because as a head of the committee, I felt this partnership will protect the project, will promote the project, will support the integrated multi-sector intervention. Next. And this collaboration will help to endorse, to develop new policies that are updated. And this collaboration will help to review the national, subnational preparedness plan, the policies and the procedures, according, as Rawhieh said, to the relevant legislation and the international standards. We can determine our needs and priorities, and we can advocate through this collaboration with mother-child friendly environment that meet the minimal requirement. And it can identify the program entry points in the sector that support nutrition. Is the entry point in the antenatal care, in the postnatal care, in the delivery room, in the child immunization clinic. Next, I think this is the last slide. So the role multi-stakeholder partnership, it's very important to supplement, to facilitate, to complement the nutritional intervention to mother and the child, the young children, and it will help in intervention implementation. It will help to support capacity building, training on the policy content, to develop the strategy plan, the action plan, and the assessment way, and monitoring to certain indicators. We can talk about it later. We can share information. Partnership can support funding of the research. It's very important for this partnership to disseminate the policy and to investigate the opportunities, what's coming up, new innovative ideas. And by the end, if we conduct the needs assessment, it will be aware that we can pass this information to decision makers who can give this legislation through giving them information. That's it. Thank you.
Thank you, Dr. Iman, so much. We really appreciate that comprehensive sort of approach and the storytelling behind this, that you have a real, you have your own experience that you have been able to share with us on sort of using existing policies in trying to implement actions in your own workspace. So on that, I'm going to hand over to Dr. Asma, who I really would like to ask the question is, what you've heard so far from what has been outlined, what are any challenges and gaps or opportunities that you have identified or encountered in your work around MIYCN, and how can we reinforce, whether they're development programs or researchers or policymakers, reinforce efforts in supporting human and institutional capacity or in supporting an enabling environment? Over to you, Dr. Asma. Dr. Asma, you're on mute.
Good morning, good evening, everyone. I'm happy to be with you, and thank you for having me. From the previous talks from my colleagues, I can add two opportunities for implementing research, which is that in Jordan, we are a well-educated people who likes to improve, to be better. We are curious to know, to ask, and we compete for teaching, and we compete for learning, and we compete to be better in the academic institutions. We had a lot of NGOs and international organizations that are working and helping in Jordan. The other issue is that political environment and the governmental institution are supporting improvement in health. At Jordan University, students are not allowed, in the Faculty of Medicine, are not allowed to be graduated unless they are part of a research. They can present or they can write proposal and conclusion, and it is a requirement for their graduation. Also, young medical students, the undergraduate, if they do research, this will support their acceptance in postgraduate learning outside Jordan, say in United States or in Britain, etc. This is what I thought about the opportunities that can help young researchers, and it can improve nutritional research. Challenges that I thought of is that, as I heard from my colleagues, that we don't have proper coordination and no proper shared vision for the research. Maybe we have fund problems, but we like coordinate, we like to work, we like to do and to improve. Other thing that there is no proper nutritional curriculum at school. Say there is something in the science book or science curriculum, but I was thinking that if you put a kind of a nutrition, if we write about obesity, early childhood obesity, or if we write even on maternal food for school students, say a kind of a lesson for information, so we can learn them that to avoid sweets, to avoid food which is rich in carbohydrates. We can tell them about exercise, even young girls, they are going to be mothers later. So we can put something in their curriculum. The gaps, the other gaps that I heard some of them, is that if I do a research in the university for my promotion, maybe someone in the other university colleague from, say, agricultural faculty, nursing faculty, medical faculty, he can do a kind of something the same, or a kind of a research that can complement my research. There is no cooperation. Maybe if we had a big umbrella to cooperate all the research, so we can get a result which can represent Jordan from the north, middle area and south of Jordan. And the other thing, if we do research, the stakeholders, they don't know about our research. They don't know about our results. So if we had uniform shared vision research, we can get the result and we can supply this, say, to the stakeholders, to the decision makers in the country, who can implement this in their policy later on. Okay, this is what I think about for the gaps, opportunities, and challenges in Jordan for research.
Thank you. Go ahead, Dr. Asma.
I was once part from the, and I'm still from the people who started maternal mortality survey and response. So with it was under the umbrella of the USAID. USAID brought the say key persons in the military services, in the Ministry of Health, in the private sectors, in the Jordan University, to respond to the maternal survey. It was maternal mortality survey and response. After the result, there was multiple meetings to decrease the cesarean section rate, because by maternal mortality survey, we know that there is a good percentage of women, mother women, who died during or after cesarean section. We make many, we had to do many meetings, then we did, say, guidelines, then audit. We tried to involve hospitals in this audit. Then we rewrite the guidelines, we offer it to the Ministry of Health, and it was adopted by Ministry of Health, and it was, it was guidelines for cesarean section reduction in Jordan. Yeah. So it's to be under umbrella of someone.
I think that's a very good example where, you're linking sort of research and evidence that is generated that is programmatic and policy relevant. And I think that's the critical part that we need to bring in the MIYCN. It's not that the will isn't there, the policies are not there. Even sometimes the system is in place, as has been noted by some of our participants. But the fact of the matter is you need to make it more dynamic and update, whether it's the system, the policies, the way it's monitored. So yeah, no, I appreciate the comments from you, Dr. Asma. And I have Dr. Rima, who is going to be using some slides. So Moad, if you don't mind sharing your slides, and then we'll jump into some Q&A after Dr. Rima finishes. And Dr. Rima, I think what we'd like to hear from you are, what are your thoughts about supporting Jordanian institutions in addressing challenges that have been outlined? Because clearly what is clear is that the system is there, the will is there, and the policies may need to be updated, but there is an understanding that this is an important issue. So what should we be doing? Over to you.
Thank you, Shibani, and I'm very pleased to be with you today. Good afternoon for the Jordanian people, and good evening, good morning for the people in the United States. So your question, I think, being the last and the last one of the speakers, I see myself as, supporting what others have said and probably repeating, but I would like also to add in some way that this is not only one sector work, it is a multi-sectorial responsibility. When we say it is multi-sectorial, we say that it includes people from the health professionals, communities, businesses, industries, organizations, government, and other segments of the society. And all of these people, they play a role in supporting and promoting pregnant and lactating mothers, infants, and young children. They have the collaborative, coordinated responsibility among different governmental and community-based advocates for MIYCN. This slide shows the sectors that are directly or indirectly involved in improving or promoting mothers and children's health. We can see like 7 sectors, probably we can have more, but they are indirectly. So the Ministry of Education, the Health, Agriculture, Social Affairs, Industry, Social Affairs, and religious groups. All of these can partner together and work on improving mothers and children's health. We'll start with the Ministry of Education. It is a major contributor to supporting nutrition, knowing that 63% of the people of Jordan are under the age of 30. And the rest of them are the families and the parents of these 60%. And the Ministry of Education has developed strategies and policies that promote school children's health. Some are already in place, but need to be strengthened through national regulatory system. One of the projects that is already in place in the Ministry of Education is the School Health Project, which was founded in 1999, and it was updated in 2005. The program serves children nutrition in underprivileged remote areas, and it works with the armed forces and the Ministry of Social Affairs in identifying eligible schools where they need to have some meal plans, and they work on preparing some brochures or pamphlets for educating school children and their parents. Let's have a slide, please, here as an example of the brochures provided by the Ministry of Education. This is an old one, but it tells us that there is some work in that direction that needs to be promoted and maybe funded for a better quality, and so that we can make sure that it is available in all public and private schools. As for the services that are provided in the Ministry of Education, we have education programs for educating children, their parents, and teachers about the right food regarding quantity, quality, and components, and to have a diverse constituents of nutrition elements. There's an ongoing assessment of knowledge, attitude, and practices toward food consumption patterns among school children, regular monitoring programs to assess the nutritional status, malnutrition, overweight, or obesity, and providing meals with the appropriate constituents of nutritious elements for children, and the control of unhealthy food marketing, which sometimes we see it in the canteens or cafeterias of the schools. Some of the challenges in the Ministry of Education is to strengthen the policies that advance a change of attitudes, of practices at schools, and these may be like promoted in public and private schools, and programs at schools must involve children, teachers, and parents, so that we make sure that it is a continuous process. Children and parents are all involved in the same plan. That's part of the Ministry of Education. Let's move now to the Ministry of Health. And we can say that the Ministry of Health has developed a national plan of action in 1996, updated in 2010 by the Ministry of Health and the WHO in coordination with all sectors. In this plan, the ministry and in coordination with concerned parties works to achieve the following: encourage healthy patterns and behaviors, including physical activities, healthy diets, and anti-smoking campaigns and other practices scientifically proven to be improving health, raise public awareness by fighting disease resulting from malnutrition, and encouraging natural nursing or breastfeeding and banning promoting alternatives to breastfeeding. And it provides necessary services for mothers and child care during pregnancy, birth, and postnatal periods. Along this line, the Ministry of Health administers vaccines and promotes family planning campaigns. And we know that it is important for the family planning campaigns because it will reduce the birth intervals, which is a common problem here that we see pregnancy is very frequent within a very short period, which affects mother's health, anemia, and other factors. So the Ministry of Health is also responsible for other aspects such as nutrition assessment plans, investment in employing nutrition counselors. This is very important for the Ministry of Health to have counselors in every center for breastfeeding or for complementary feeding, and not as what Doris just said, that it's not, it has to have a specific job description that these people are employed for the sake of being as a nutritionist in their location, and not to have multiple roles such as a midwife, a nurse, and a nutritionist. So it is important for the Ministry of Health to equip healthcare providers with knowledge about mothers and children nutritional needs, develop guidelines for measuring and monitoring nutritional status, preparing midwives and nurses to implement ongoing follow-up visits. And this is very important because we see that in the community, we don't have nurses that take this role of community visits. So they are only requested in the center and they don't go to the community to assess the needs. And then to raise awareness of pregnant and lactating mothers about their rights to breastfeeding and complementary feeding. So we need to orient them that it is a right or not just something that they have a choice to follow what is already traditional thinking, and developing and enforcing policies that support breastfeeding. The third sector of this collaboration is the Ministry of Agriculture. This sector is not directly involved with mothers and children, but the general community. And then we say that it is, if we are correcting the nutrition of the community, we are also caring about mothers and children. So this Ministry of Agriculture has the responsibility towards food production, such as food and vegetables that are safe for the community. And this implies developing policies for food safety, food products that are free from fertilizers and pesticides, livestock and poultry availability and adequacy, supporting farmers in addressing challenges of water shortages, and educating farmers about modern techniques in agriculture. Some of the challenges of the Ministry of Agriculture is to secure safe and affordable food, vegetables and fruits, climate change, water scarcity and seasonal locust waves, safe use of fertilizers, pesticides, and information to farmers for proper use of these materials, and distribution of the land. The fourth of these sectors is the Ministry of Social Affairs, and this is where it works with the poverty and the population that needs help, financial help. The ministry undertakes a number of activities, programs, and services in areas such as family, childhood, and social defense, and special education. It works It is implemented through 5 directorates. 2 of these directorates are directly involved with the family. One of them is the Family and Childhood Directorate, and the second is the Directorate of Poverty Monitoring and Social Security. So these 2 directorates are involved directly with identifying cases in remote areas where they need nutritional help by supporting them with meal plans and so on. And the academic institution, which is a major part that we need to focus on in this session, it is, we know that university and institution for academic research is a huge opportunity of human research capacity. They have this huge capacity in health research, agriculture, economy, and industry. But we have many challenges, and we came across some of these earlier. So to sum these up, no strategic plan for research priorities, and when available, this is not financially well supported to be conducted at the national level. Academic staff priorities are focused on research leading to academic promotions. Academic staff are overwhelmed with teaching responsibilities, leaving them with no time for field research and transfer of research results into the field, and lack of coordination, as we heard earlier from Dr. Iman, Dr. Asma, and Doris, that we don't have enough coordination between the sectors to make like complementary kind of research. The sixth of these collaborators or sectors is the industry and marketing, which needs to be strengthened, enforce policies that set standards for food safety, manufacturing, and marketing of food, policies that encourage the production and manufacturing of affordable fixed food price, such as vegetable, fruits, and poultry and dairy products for the underprivileged communities, and policies that encourage working with other sectors, the Ministry of Health and other sectors. And the final one is to talk with the religious groups and to have the religious group employed to employ the cultural religious influence in changing. Can we have the slide, please? The last one of these slides. Yes. So it needs to, we need to employ the cultural religious influence in changing attitudes and practices that need to be changed, and use this, as it is said, for example, just one example, in encouraging breastfeeding, والوالدات يرضعن أولادهن حولين كاملين, which is translated as the mothers shall suckle their offspring for 2 whole years. So it is very nice, and it would be very encouraging to use the religious discourse to change some attitudes, some practices that are misconception in this society, and then we can have like all the sectors working together to bring the whole process as a holistic approach to improving and promoting mothers and child health. And thank you for listening.
Thank you so much. Thank you so much, Dr. Rima, for moving this in the direction of a discussion. And I see Engineer Rawhieh, you have your hand up. Maybe you, before I jump into some comments and questions, do you want to say something?
Yes, I want to just add something regarding Dr. Rima, what did just have said, that we have a multi-sectorial committee from all sectors in Jordan that are working on the food security by the availability and accessibility for the healthy diversified food at a household includes the mother and child. And through this committee, we reformulate the regulation and the legislation regarding some on the food. We are working on the food system to promote, to access the healthy diet, and to establish a healthier food environment. So we are working in low consumption of salt, sugars, and trans fatty acids.
Thank you, Engineer Rawhieh. I think what has been really outlined in this entire panel is that, you know, there are some comments actually also from Dr. Hanan Al-Najmi in the Q&A. I do want to highlight the fact that there are systems, there are services. The question is then, what is the missing link then? Because we are seeing epidemiologically the rates of overweight and obesity in Jordan. And we're also seeing epidemiologically that there is issues around IYCF feeding and practices. And I think that is really what comes out, that, you know, the will is there. There is some coordination, but not enough. There is need for research that is policy relevant, but that also links to policymakers and programmers, as Doris has outlined, that's a very critical approach when you're trying to implement an intervention. And then, as Dr. Iman has outlined, that, you know, we might need some stakeholder capacity building on how to implement these actions, right? Because not everybody might have information at hand on how to, for instance, implement a baby-friendly initiative, which, Dr. Iman pointed out so nicely with her own experience in setting it up in her own facility. And so I think that what it's telling us is that the will is there. There is need for better coordination. We have to be strategic. We have to update our policies and actions around policies. And so that would be, and having multi-stakeholder partnerships, which I think Dr. Iman, you pointed out, but also Dr. Rima, the idea of multi-sectorality and thinking about this beyond the health sector, because often the onus lies on the health sector for delivering on results and policies, when in fact, I think the issue when it comes to nutrition and the double burden goes beyond the health sector as well. So thank you so much to our panel. We have like 5, maybe 6 minutes left. And what I was thinking that maybe I will throw one general question, and I do apologize to the participants. I wanted to take this opportunity to let all our panelists give their thoughts, and I'm hoping some of the questions are kind of answered, but I want to give one question is specifically that is coming up is around supporting women in lactation. And in terms of maybe Doris, you could answer how women can be supported around lactation, how CHN is working. And there's also a question around, is there going to be work on the national code, the sort of code for breastfeeding? So maybe Doris, if you can just take 1 minute to answer very succinct way.
We have to talk about 2 types of lactation support, and I'll be really quick. There's your general, basically promoting breastfeeding. It's easy, working on latching, working on sort of straightforward breastfeeding. And that can be received either through the community. There are community-based organizations or groups or community mobilizers or volunteers or peer-to-peer support where they can get that help. But there's also another step that is more of a professional approach to lactation counseling, because there's a lot of issues that happen. We all assume breastfeeding happens naturally. But women who have breastfed or know women who have breastfed realize it's really not as easy as we think. It's not sort of you just put the baby and he latches on properly. There are a lot of issues. Some are physical, some are emotional. And so you need much more one-on-one and focused lactation support to be able to cover all these issues in a way that resonates and addresses the issue that the mother's going through. So it's not really a quick, let's give you an update on the importance of breastfeeding. It's really sitting down with the mother and making sure that her journey in breastfeeding starts properly and is given the right support, whether physical or emotional or referral, because sometimes you might not have the right skills. And this is why we looked at professionalization of the lactation counseling to give it that importance.
Wonderful.
Thank you.
And I think as a follow-up, I think Dr. Iman, one of the comments that came up, or maybe it can be you or Dr. Ima, that there is counseling on breastfeeding during ANC, during PNC. There's also indicator measurements that happen within the context of the public sector, health service delivery in the public sector in Jordan. So what is in just 30 seconds, what is the gap there then at the service delivery level that you have encountered as a service provider?
First, we have to sensitize the directors of the institution. Sensitize them how this is important. We have to sensitize to do women empowerment. Women empowerment in the institution. Women have to know that she cannot. She has the right to express her milk while she's working. So we have to sensitize their colleague, their manager. This is the first. Second thing, I think there should be a political will that the managers of the institution are pushed to implement the programs and this. This is, I think, the key things which we can do. Everybody is willing to do the implementation, but the directors, the managers, mostly males, they are need to be engaged, supported. This is my opinion.
Right. Thank you. And I think what you're highlighting is what Dr. Rima pointed out in her presentation, that really it's not just about the Ministry of Health or the health services. Yes, there is critical need for lactation counseling, but it's also about the fact that other sectors need to work. You know, we also have, Dr. Asma mentioned about schools and curriculum in schools. So you're generating an awareness and therefore demand for services in the future, like Doris has pointed out, by young women, that they know that they have better diets and you know, they have access to better diets and better healthcare, which would be the starting point. And I think, Dr. Asma, you have your hand up, so I'm going to hand it over to you. And we've got 1 minute
yes.
left, and I do want to make sure that we don't go over more than a minute. I hope we'll go over by a minute. So over to you.
Yes, I supported Dr. Iman in her breastfeeding issues. When I became the director of the OBGYN, we make it privilege for the resident to have lectures for to be we gave them lectures about breastfeeding. They had privilege. We taught the midwives, the nurses in the delivery room, and they have to take on their notes that I did make breastfeeding. I did advise. We do push for the breastfeeding initiation and continuation at Jordan University Hospital. Thank you.
Yeah, thank you so much. Yeah, and I think so that's really helpful. I mean, there is again, it's sort of pointing out to the fact that there is a will, there are actions already in place, but we need to do it at scale in Jordan so that we can shift the numbers. Dr. Rima, the final word to you, and then I'm going to hand it over to Sama.
Yes, I would also like to emphasize the role of the primary healthcare centers, where we don't wait until they are in the hospital in birth. So they start in the primary healthcare center, they take the education, they are prepared, and they are supported, just supported when they are in the hospital, just to encourage them to continue this process. And information is very important, and empowerment of women to know that this is a right.
Thank you so much, Dr. Rima. And I want to thank all of you for joining. Before I hand over to Sama, I just want to do a quick introduction. Sama Al-Quran is a program management specialist at USAID Jordan and is a very strong advocate for our activities in Jordan, both the JNIL as well as CHN, but specifically on activities around maternal, infant, and young child nutrition. We're so glad that she's able to join us to give some closing remarks. Before I hand it to you, Sama, I just want to, one housekeeping detail. I apologize to the participants. We couldn't get through all the questions, but we will try to get responses to you. I put that out in the note earlier that we will try to get it over to you through our mailing list, through our Twitter, and through our different platforms. And so please keep an eye out for some of the responses that we will gather from the rest of the panel. We could have continued talking for another hour for sure, but it's been an hour and a half since we were on this. And so thank you so much for joining, and over to you, Sama, for closing us out.
Thank you, Shibani. Good morning, good afternoon, and maybe good evening, everyone. Actually, on behalf of USAID Mission here in Jordan, I'd like to extend our gratitude and appreciation for you all. First, to the respectful attendance and the active discussions on the chat box and the Q&A box. Secondly, to the esteemed panelists for their commitment and the devotion to contribute to this event. And finally, to the Jordan Nutrition Innovation Lab team for making this event happening. I really hope that you have enjoyed the presentations and the discussions. We're looking forward for your participation in more webinars in the coming future. We rely on you to spread the word about the open fellowships that we have announced and the other future webinars and events to boost the participation from the Jordanian academics, researchers, experts, specialists around maternal, infant, and young child nutrition in Jordan, in order to hopefully strengthening the research and policy around this very important area. And hopefully we will be able to create a constructive cohort of MIYCN champions in Jordan. Thank you, everyone. Stay safe and enjoy the rest of your day.